The purpose of a CoFlex compression dressing is to reduce lower extremity edema in preparation for long-term edema management. It may be used after a vascular assessment determines that the arterial flow is sufficient to tolerate compression safely. Depending on the volume of edema, several or more CoFlex dressings may be needed over several weeks to reduce edema until the patient's girths plateau and they are ready to transition to a long-term form of edema management, such as a Circade or a compression stocking. The CoFlex light dressing is composed of two items, the absorptive foam layer and the cohesive compression layer. The kit also contains a piece of tape and a nylon sheath to cover the cohesive layer. When applied correctly, the CoFlex Light generates 20 to 30 millimeters of compression force around the lower leg. The standard CoFlex generates 30 to 40 millimeters of mercury compression force. Before applying a CoFlex dressing, visually inspect the patient's skin, and if wounds are present, dress them according to current orders. To apply, position the ankle at a 90-degree angle and wrap layer 1 starting at the metatarsal heads in a spiral pattern toward the heel. Wrap behind the heel, skipping the heel, then return to cover the heel. Proceed up the lower leg with a 50% overlap of each layer, ending just below the knee. Using a scissor, cut or hand tear the foam layer and tape it with the included piece of tape. Using the same technique, apply the cohesive layer. To determine how much stretch to apply to the cohesive layer, refer to the oval indicators printed on the material. The ovals will change to circles when the appropriate amount of stretch has been achieved. Too much stretch will change the circles to ovals again. Tear it at the top of the calf also. Gently press the entire dressing, ensuring a strong bond between the two layers. Encourage the patient to do their ankle pumping exercises if they are not ambulating. You may apply the included nylon sheath over the completed CoFlex compression dressing. If a person has sensation, they should feel a firm yet comfortable amount of compression, especially when they pump their ankles or ambulate.